Hello, my name is Nicholas Morton, and today I'll be talking to you about mitochondrial encephalopathy lactic acidosis stroke-like episode syndrome, better known as MELAS. Throughout this presentation, I will be giving a brief overview of MELAS, including how common it is, what the symptoms look like. Then I will be talking about the mutations in the mitochondrial DNA and give examples of someone who has MELAS. I will then end the presentation on some of the treatments and the research that is currently being done. So we're going to start with what MELAS is. I'm going to give a brief overview of what it is. MELAS syndrome is a progressive neurodegenerative disorder caused by mutations in the mitochondrial DNA. This leads to a large buildup of lactic acid and results in a variety of symptoms. This is a rare disorder that begins in childhood and mostly affects the nervous system and muscles. Mitochondrial diseases occur in about 1 in 4,000 people, though it is unknown the number of MELAS since it is so rare. So now I'm going to be talking about some of the symptoms and highlighting the most common ones. Signs and symptoms can begin at any age, though they most often appear in childhood following a period of normal development. Some of the symptoms include seizures, loss of appetite, weakness, and pain, as well as recurring headaches. In extreme cases, MELAS syndrome can lead to stroke and dementia. All of the possible symptoms and signs can be seen on the left. MELAS syndrome has a high mortality and morbidity rate. The stroke-like episodes can be extremely serious, and seizures may occur during these episodes as well. Cardiac problems such as cardiomyopathy may result from the syndrome, and these are fatal. Now I will talk a little about the mutations that occur that cause MELAS. The gene that is affected to cause MELAS is a mutation in the mitochondrial DNA, or mtDNA for short. In most cases, it's the M3243AG or AT mutation is what indicates that someone has MELAS. This is an A to G or A to T point mutation that occurs in the transfer RNA loop. Since MELAS is a genetic condition, it is inherited from the mother if she's infected. If the father has MELAS, then it won't be passed down since all the mitochondrial DNA is passed from the mother to the children. As you can see in the image to the right, it illustrates 3 generations. In the first generation at the top, the mother has MELAS, but the father doesn't. Therefore, it is passed down to their son and their daughter. On the left side, the son has 3 children in the third generation, which do not have MELAS since it can only be passed through the mother. On the right side, you can see that the daughter of the first generation has MELAS and can pass it down to both of their kids. This is because all the mitochondrial DNA comes from the mother. Both normal and mutated mtDNA can exist in the same cell. This is called heteroplasmy. In these cases, there must be a significantly larger amount of mutated mtDNA than regular mtDNA present. This amount changes based on where the mutation occurred and what kind of cell it is located in. Due to this, a variety of different symptoms can occur in affected families. There are also some rare cases in which there's a spontaneous mutation in mitochondrial gene that is not inherited but can cause MELAS. Now I'll be talking about a reported case of MELAS. The case that I'm presenting is about a 15-year-old boy who displayed normal development and growth until the age of 11, when he started experiencing tonic-clonic seizures. Tonic-clonic seizure has 2 different parts to it. The first is the tonic seizure, which is stiffening of the body. Simultaneously, a clonic seizure can occur, and usually does, which is the twitching of muscles. These seizures occurred several times a year, from the age of 11 to 14. He was given carbamazine, lamotrigine, and topiramate to help control his seizures, which I will talk about later. His academic performance declined and he lost 10% of his body weight in 3 months. He was then admitted to hospital. His height and weight were normal, though he did show cerebral symptoms such as dysmetria and intention tremor. He presented a mild muscle weakness and elevated lactate and pyruvic acid levels in his blood. This is typical for MELAS. An MRI was performed on admission to discover small multifocal gray matter regions in the right temporal, parietal, and occipital lobes, and diffuse white matter lesions in the left temporal lobe visualized as high-intensity areas. This can be seen in the top left image here. So you can see there's a lot of damage in the brain, especially in this bottom left area. During time in the hospital, he experienced a stroke-like episode that left an extended white matter and left thalamic lesions. This can be seen in the bottom two left images. As you can see, there is a lot more damage on the left side of the brain than from when he was admitted. He was administered drugs to help with the damage that occurred before a sample of DNA was extracted from his white blood cells. An M3243A to T mutation was discovered, which is linked to MELAS, and he was later diagnosed with MELAS. So I'm going to talk a little bit about some of the treatments that are used and some of the research that's being done. So though there is no cure for MELAS syndrome, there are ways to help someone with symptoms that they are experiencing. Anticonvulsant drugs, such as previously mentioned carbamazepine, can be used to prevent or control seizures. A patient may be given a cochlear implant to help with deafness. This can be seen on the right side of this slide. Arginine can be given to reduce recurrence of stroke-like episodes. This can be either given orally or injections. The doctor may also recommend that they have moderate training using a treadmill to reduce the lactate levels at rest. Genetic counseling is recommended for affected individuals and their family to make sure that everyone knows that MELAS is in their genes. So there is some research being done. There's actually quite a bit of research being done. There's a lot of medications currently being researched to help the battle with MELAS. Medications can be seen on the screen at the top left, and some of the ones that I will be focusing on are dichloroacetate and adabonin. But thiamine and coenzyme Q10 have also been used quite a bit with MELAS. So one of the most cutting edge research projects being done is at the Columbia University in New York City. They're currently conducting a double-blind placebo-controlled clinical trial of adaboninone in MELAS. This study will compare two different doses of the medication administered over a 1-month period to determine the efficiency of the drug. People with the 3243 mutation, whether that be A to G or A to T, are targeted. The main goal of the study is to determine if adaboninone has an effect on brain lactate as measured by an MRS, and the MRS will conduct once a week for the whole month. There's also a study similar to this being done where they're using the drug dichloroacetate in high doses to reduce the level of lactate in the brain. This is a long-term study as it is 3 years. Study is ongoing and results won't be available for a while. Both of these studies are in phase 2 testing and have had positive results so far. Though these aren't cures for MELAS, these treatments will hopefully one day make MELAS less fatal. Thank you for listening to my presentation, and here are my references.